Thank you very much for an opportunity to share our experience with you today. And I shall speak about reproductive problems in couples and new ways to overcome them. Okay, let's start with statistics. And it's really rather sad because 1 of 6 couples are struggling to conceive worldwide. And you see that it's more than 17% globally. And if you shall calculate, it's more than 48 million couples are struggling infertility. Well, no, I don't know what's really happening. Okay, here you can see the map of the statistics on infertility in different regions. And if we shall have a look at the Southeast Asia region, you can see that first of all, we do not have enough data because only 9% of all data available to World Health Organization was provided from these regions, but still it is one of the regions with highest rate of infertility. No, it's back. Okay, so I think many of you know that all factors of all infertility factors could be divided into 3 groups. Those are female-related, it's almost 50% of all cases of infertility, male-related, and also the combination of both. And different reasons are underlying infertility. But in my research, we are addressing infection factors as the most important for infertility, especially in this region. So, okay, and I shall start with women. Because women's health is in one or another way is always related to reproductive health. Women are extremely vulnerable to sexually transmitted diseases and infections, many of which are asymptomatic but could be life-threatening. But sexually transmitted infections is just one small part of reproductive tract infections, many of which are endogenous, like, for example, bacterial vaginosis or aerobic vaginitis, because the bacteria, which are the causative agent of these conditions, they are hovering vagina, so they are living inside human body in vagina precisely. Also, we can deal with heterogeneous infections, which also could be associated with infections and bacteria, viruses hovering vaginal tract and reproductive tract of women. Vaginal microbiota of a healthy woman protects its uterus during pregnancy against different pathogens, sexually transmitted infections, and also different opportunistic infections. And also it's very important for the development of the microbiome of the newborn baby. Okay. And normal vaginal microbiota also protects a woman against sexually transmitted pathogens. You know that many of them are of bacterial origin, and these curable pathogens are well known to us. They are Chlamydia trachomatis, Neisseria gonorrhea, Trichomonas vaginalis, and Mycoplasma genitalium. All of them are obligate pathogens. That is why it's mandatory to treat both partners in a couple. And the primary method of diagnosis is qualitative PCR. So this is the recommended by WHO method for diagnosis of this infection. But if there is no sexually transmitted infection pathogens, if we can't find this single pathogen, all of them are absent, the situation in dysbiosis always connected with a group of bacteria, and it's really difficult to find out the single responsible microorganism. And in this situation, when we are dealing with dysbiosis like bacterial vaginosis or aerobic vaginitis, they have to use different quantitative techniques and molecular-based techniques like polymerase chain reaction. PCR is the best choice for us. Well, let's speak a little bit about vaginal microbiota, because our ideas about vaginal microbiota changed a lot during the last century. It was Professor Duderlane who was the first who described gram-positive rods in vaginal smears of healthy women by microscopy. Then in the middle of the 20th century, we managed to identify by cultures this species. It was Lactobacillus acidophilus, who was detected also in vagina of healthy asymptomatic women. But with the help of molecular-based technique at the end of the 20th century and the beginning of this century, we found out that there are dozens of Lactobacillus species inhabiting female vagina. And what was even more interesting, that different species of Lactobacilli could be predominant in healthy vagina, but they have different potential for protection against endogenous infection and sexually transmitted infection. And it's really interesting nowadays to perform a genotyping of Lactobacilli. Oh no. But together with Lactobacilli, a wide variety of opportunistic bacteria are living in reproductive female tract. The majority of them are obligate anaerobes. Many of them are well-known associates of bacterial vaginosis like Gardnerella vaginalis, Pannichessia vagina, former Etopobium vagina, bacterial vaginosis associated bacteria, and so on. Also, we can find the facultative anaerobes. They constitute up to 10% of opportunistic bacteria in vagina, and many important pathogens are there. Enterobacteriales, Staphylococcus species, Streptococcus species, and so on. Also, we can find genital mycoplasma, opportunistic mycoplasma like Ureaplasma, Urolithicum, and Parvum, and Metamycoplasma hominis, and just like fungi. There are still three approaches, and they have changed during the last century for diagnosing of reproductive tract infection. We use all of them: microscopy, culture-based technique, and of course molecular-based technique. If we will speak about the microscopy, microscopy is fast and rather cheap, and the diagnosis of bacterial vaginosis or vulvovaginal candidiasis is based on microscopy. But still, there are a lot of diagnostic errors. More than 50% of diagnostic errors is really too much when we are speaking about a precise medicine. Then culture-based technique. Now, they are good because we can detect viable bacteria. We can perform antibiotic testing, but still, the majority of reproductive tract bacteria and viruses, they are non-culturable, or they are fastidious, or they could not be detected by cultures. That's why we speak about molecular-based technique, and of course, PCR will help us. And when we speak about opportunistic bacteria, it's very important to calculate the quantity of each species and to calculate the proportion of these species in the total bacterial community. That is why quantitative PCR is the preferable method of diagnosis. So in 2008, the Femoflor test panel was developed to assess the microbiota of the female reproductive tract. The first two tests were Femoflor screen and Femoflor 16. I shall tell a lot about all those tests today. The first one was developed for screening for sexually transmitted infections, for herpes virida, candida species, Lactobacilli, and Gardnerella vaginalis. But when sexually transmitted infections are absent, it's more useful to use Femoflor 16 test, which allow us to perform a comprehensive assessment of vaginal microbiota. And this year, a new test, Femoflor 2, was developed for complete microbial vaginal microbiome analysis, and now we can analyze not only the composition of opportunistic bacteria and lactobacilli, but also sexually transmitted infections, HPV, herpes viridae, and so on. I shall show you the examples. So, first of all, I would like to show you the example of lab report for Femoflor screen test. It's the first test, it's the shortened version in this panel, which allow us to detect obligate pathogen sexually transmitted infection, and here you can see that Chlamydia trachomatis is present, and the proportion of lactobacilli is a very important character of this test. Is less than 80% in total bacterial load, so this corresponds with vaginal dysbiosis. So you can see it over here, lactobacillus proportion. Also, we found Candida species in 10 to 4th power genome equivalence per sample, which is above the threshold, and so the signs of vaginal candidiasis also could be observed in this patient. And no mycoplasmas in the test. Then here you can see the composition of Femoflor 16 test. This test, as I told, was designed for a comprehensive assessment of vaginal microbiota, so it allows us to quantitatively assess lactobacillus species, facultative anaerobes, obligate anaerobes, 3 groups and 8 groups, then genital mycoplasma, yeast-like fungi, and also we have the sample intake control in the test. And now I would like to show you the algorithm for automatic generation of lab report after the PCR run is over. The main characteristic of this algorithm is the proportion of lactobacilli in vaginal community. When it's above 80% in the community, we speak about eubiosis or normocenosis, and this condition could be divided in 2 more variants as absolute normocenosis, when we do not find mycoplasmas, yeast-like fungi, and another type, and it was absolute normocenosis. But if we shall detect Candida species or Uroplasma species in quantity above 10 to 4th power, then we speak about conditional normocenosis. When the proportion of lactobacilli is less than 80%, we speak about dysbiosis, and there are 2 types of dysbiosis suggested. The severe dysbiosis when the proportion of lactobacilli is less than 20% in total bacterial community, and moderate dysbiosis when the proportion of lactobacilli is between 20 and 80%. So here you can see again the criteria for eubiosis, normocenosis, and dysbiosis. You can see that when the proportion of lactobacilli decreases, the proportion of opportunistic bacteria increases, and we speak about the dysbiotic condition. Now I would like you to show some examples of lab report generated by special software. And here you can see the example of eubiosis. It's normal microbiota. What is typical for this condition? The proportion of lactobacilli is above 80% in total bacterial load, and there is there were no, I shall come back, no opportunistic bacteria, they are less than 20%, and no Candida species, no mycoplasmas. Then this is the example of severe anaerobic dysbiosis. Why? Because the proportion of lactobacilli is less than 20%, and the proportion of obligate anaerobes is above 80% in total bacterial load. So it's really very easy to interpret. This is the severe aerobic dysbiosis when the lactobacilli proportion is also decreased, and the proportion of aerobic bacteria, Enterobacteriaceae in this case, is increased. Now, and this is the example of mixed infection when we deal with moderate anaerobic dysbiosis because the proportion of lactobacilli is decreased. Also, we can see here the increased numbers of anaerobes, and also we have found DNA of Candida species here in 10 to 4th power. Next, I would like to share with you some real clinical examples, and we shall discuss how different laboratory tests could be compared, their results with Femoflor 16. So here you can see the microscopic results of a lady, of a symptomatic patient without any signs and symptoms of vaginal infection, and her microscopic picture is absolutely normal. And also, the Femoflor 16 gives us eubiosis, normal microbiota with predominance of lactobacillus species. So they are absolutely concordant results. This example is more difficult because here you can see the microscopic picture of non-specific vaginitis, because high counts of white blood cells. The ratio of white blood cells to epithelial cells is above 5, but look at microflora, gram-positive rods, so we really do not know what's with this patient. And this is a lady with vaginal discharge, so she has signs of non-specific vaginitis, and with the help of Femoflor test, we can see that it's a conditional normocinosis. Really, lactobacilli are predominant here, but Uroplasma species is above 10 to 4th power genome equivalence per sample. And with this data, we can offer her the treatment. You see that this lady will need systemic treatment with doxycycline, most probably, according to the presence of uroplasma in the sample. This example is also rather difficult because this microscopic picture is of so-called intermediate type because no white blood cells. We can see also the mixed microbiota here, but you see this lady was prepared for the natural cycle frozen embryo transfer. And and she had no symptoms of vaginitis, but still her gynecologist suggested to perform Femoflor test, and you see that we have found anaerobic dysbiosis. And anaerobic infection put her at risk for the unsuccessful implantation and for preterm birth in future. Finally, she was treated according to the results of the test. Here you can see them. And, well, she got pregnant. She is pregnant right now. Next, I would like to show you the comparison of this test with cultures. You can see two examples here. The first one, cultures gave us Candida albicans in patient, and when we have performed Femoflor test, we also found Candida species here. But it wasn't the only pathogen, because we also found anaerobic dysbiosis, and so the treatment will be absolutely different. The other lady even more interesting, because cultures were negative, no bacterial growth. Why? Because she had anaerobic dysbiosis, and we couldn't find these anaerobic bacteria using cultures. And another two ladies, both of them had cultures positive for Streptococcus. But you can see that in the left, both of them, of course, were positive for Streptococcus in Femoflor 16 test. But the left one had aerobic dysbiosis, so this is consistent with aerobic vaginitis, and of course she had to treat it for Streptococcus infection, and the other one had anaerobic dysbiosis. And so if we shall treat her similar to the lady in the left, most probably she will come with another episode of vaginitis in 1 month or in 2 months, well, in future. Oh no. So, and also we have found uroplasma there, which couldn't be found by cultures. Also, Femoflor tests allow us to understand whether do we need to restore vaginal microbiota about antibiotic treatment. And here is the example of such a patient. You can see her results before the antibiotic treatment. She had anaerobic dysbiosis. Then, because Pannichessia vagina or Atopobium vagina was detected there, so she was prescribed clindamycin. So here you can see her results after the clindamycin treatment. The microscopy perfect, no white blood cells, no bacteria practically, and also we can see that very low total bacterial load even by Femoflor screen, no lactobacilli. Then she was prescribed oral probiotic, and here you can see her results after this treatment. So very nice results, I would say. And next, I would like to speak about the connection between vaginal dysbiosis, which we can detect with Femoflor test, and preterm birth, because it's a huge medical and social problem. And you know that many children who suffered neonatal mortality due to preterm birth. So we have to prepare some new tools for prognosing preterm birth in women. The connection between vaginal dysbiosis and preterm birth is well documented. And there were a few attempts to develop some prognostic indexes to predict this condition. So, of course, we decided to make one another attempt using Femoflor test. What we have done. There were 199 women in our study, enrolled in our study, and we have conducted Femoflor 16 test in the first trimester of the pregnancy, and then we have looked for the outcomes of the pregnancies. And comparing their results, we managed using discriminative analysis to develop this prognostic index, which we called PRIMA, which stands for Preterm Birth Index of Microbiological Analysis. And you can see 8 parameters of Femoflor 16 test, which were significant for calculating this PRIMA index. If PRIMA index was above 0, then the risk of preterm birth was low. If it was below 0, the risk of the preterm birth was high. And here I can show you 2 examples. The lady in the left, she had eubiosis or absolute normocenosis according to Femoflor test in the first trimester of the pregnancy, and her PRIMA index was 1.73. And so she gave birth at 40 weeks of gestation. The other patient had moderate anaerobic dysbiosis, which could not be detected with any other tools, especially by microscopy. And her PRIMA index was minus 1.39. And so she had preterm birth at 30 weeks of gestation, and her boy was transferred to intensive care unit, but thanks God he is alive. So this PRIMA index allow us to predict the preterm birth from the first trimester of pregnancy and to perform the necessary treatment to these patients. You just need this test and the calculator or Excel tables to provide this testing. Here you can see QR codes, which will bring you to the articles where you can find the formula for PRIMA index. And now I would like to speak about Lactobacillus species genotyping. And I shall start from a very interesting study which was conducted in USA by Ravel and his team. He was the first who in 2011 suggested the conception of vaginal community state types for healthy women, first of all, which looked not only the presence of lactobacilli, but also at the lactobacilli species. And so they suggested later in 2020 this Valencia classification and 5 types of community state types for vaginal microbiota, which were connected with different species of lactobacilli. Why is it interesting? Because the first type, CST1, was characterized by the predominance of Lactobacillus crispatus. And nowadays we know that not only lactobacilli presence is important for the health of vaginal microbiota, but it's very important to have some specific species of lactobacilli, and Lactobacillus crispatus is the preferable type of lactobacilli. Then Lactobacilli gasseri was typical for the second type, Lactobacilli iners, which is unfavorable type of lactobacilli. Even some doctors now speak about crispatus woman and iners woman as two opposite types of vaginal microbiota in women. Lactobacillus iners is connected with dysbiotic conditions, and their protective potential is rather low. Then there is CST4 without lactobacilli. It's a dysbiotic type of vaginal microbiota, but still it could be found in some healthy asymptomatic women. And the fifth type with predominance of Lactobacillus ganseri and vaginalis. And in 2011, they have conducted a study of healthy asymptomatic women of different ethnic groups in America. And what is interesting, that women who belong to different, here you can see 4 different ethnic groups, have different types of microbiota in vagina. And for example, if we shall speak about Asian women, then in majority of cases, there was the third type of community with Lactobacillus iners. It's unfavorable type of lactobacilli. And for example, for black group, there was more than 40% of dysbiotic type of microbiota. And so here it comes to our new Femoflor test, which allow us to genotype vaginal lactobacilli, and we can compare now our vaginal microbiota with this Valencia classification. So what allow us new Femoflor to detect? Not only Lactobacillus as species, but also Bifidobacterium species, which is important for women in menopause. Then we can perform genotyping of Lactobacillus, detecting Lactobacillus crispatus, iners, gasseri, and Paragasseri, Jensenii, and Mulieris. Then, of course, we shall detect facultative anaerobes and, for example, not only Streptococcus, but Streptococcus agalactia, which is important also for postpartum infections. Enterococcus and Haemophilus are also detected nowadays. And the wide spectrum of obligate anaerobes. But that's not all, because also we detect mycoplasmas differentially. Then we can detect not only Candida species, but also Candida albicans, and sexually transmitted infections like Candida trachomatis, Chlamydia trachomatis, Neisseria gonorrhoeae, and so on. And a wide spectrum of reproductively important viruses, HPV, HSV, and CMV. And so here you can see the results of new Femoflor. You see 2 pages for this test, because it's really the entire vaginal community. And this is the example of eubiotic vaginal microbiota, which is consistent with Valencia classification CST1, because it characterized with the predominance of Lactobacillus crispatus. Here you can see that Lactobacillus are 99% of all vaginal microbiota, and Lactobacillus crispatus is predominant here. And also a very good conclusion is here, it's also automatically generated, and so it's very easy for a physician to understand the results of that test. Next example is typical for the eubiosis with predominance of Lactobacillus iners. As I told, it's unfavorable type of bacteria, and also we can see here that Lactobacillus are predominant, but this predominant type is Lactobacillus iners. It's the only species of lactobacilli detected here. Again, the conclusion, no pathogen DNA in this sample. Another example of this test is with dysbiotic tip and predominance of Streptococcus here. You can see it here, it's moderate aerobic dysbiosis. And also HPV was detected here, so we can get the entire conclusion about vaginal microbiota state. And another example with severe anaerobic dysbiosis, which is consistent with dysbiotic type according to Valencia classification, and also chlamydia trachomatis and HPV is detected here. So we can see mixed infection, which could not be detected with any other test before time. And the last example, the patient who was also detected with Neisseria gonorrhea by this test. She had severe anaerobic dysbiosis, but the presence of Neisseria gonorrhea, of course, is very dangerous, and we have to treat her sexual partner as well. So, and next we shall speak about male impact, about male urogenital microbiota and its impact on the infertility and fertility. What is the main reason for male patients to seek medical help? Usually it is non-gonococcal, non-chlamydial urethritis, which could be associated with different opportunistic bacteria like Enterobacterialis, Haemophilus, Streptococcus, Staphylococcus, but still the role of obligate anaerobes was not confirmed for this condition. That is why we had to develop another test constructed specifically for male genital microbiota, and it's Androflor real-time PCR detection kit. You can see that these tests allow us to detect 24 groups of microorganisms, including total bacterial load, obligate pathogens, which is very important, gram-positive facultative anaerobes and gram-negative anaerobes, obligate anaerobes, genital mycoplasmas, yeast-like fungi, and also this test has sample in direct control. There are two types of Androflor tests in the panel. The first one, Androflor screen, is a shortened version which was developed for the detection of sexually transmitted infections primarily and some acute conditions. The other variant is Androflor, which allow us also to detect a lot of opportunistic bacteria, including obligate anaerobes, genital mycoplasmas, gram-negative and gram-positive facultative aerobes. And the criteria for assessing male genital tract microbiota are a little bit different than female, because we could not speak about the predominance of some specific group of microorganisms there. So how do we analyze the results of the test? First of all, we analyze the total bacterial load, and it's considered clinically significant when it's above 10 to 4th power genome equivalence per milliliter. Then we have to assess the presence of human genomic DNA, because it will it will ensure us that we have epithelial cells in the sample. Otherwise, the test is invalid. Then we analyze the presence of transient microbiota, which is Lactobacillus for men, because Lactobacillus could be present in male sample if there was the unprotected sexual intercourse in 2 or 3 days before the sampling. And if these quantities are very high, we have to recommend the patient the resampling. It would be really useful. Then normal microbiota for male patients are different gram-positive facultative anaerobes like Staphylococcus, Streptococcus, Corynebacterium, and so on. But also we can find opportunistic microbiota which are normally absent. And of course, obligate pathogens like chlamydia, Neisseria gonococcus, Trichomonas vaginalis. DNA of these pathogens has to be absent in the samples. And DNA of candida species must be below 10 to the third power genome equivalence per equivalent. We can analyze different biological materials obtained from male genital tract depending on the clinical presentation. If we're speaking about the diseases of the lower urogenital tract, like urethritis, balanopathitis, we can use epithelial scrapes or first void urine. Absolutely non-invasive, the second variant. If we speak about the diseases of the upper urogenital tract, like prostatitis or epididymitis or orchitis, it is better to use prostatic fluid or residual urine after prostatic massage, semen samples, and even biopsy of prostate. And here you can see the examples of report. This is the example of Androflor screen test lab report. You can see that total bacterial load here is 10 to 4.6. Then we have found predominantly commensal bacteria, so it's absolutely normal. Then we have found Candida species above the threshold level, and no DNA of sexually transmitted pathogens in this sample. And this is normal microbiota according to Androflor kit. This is total kit. It's a comprehensive analysis of male genital tract microbiota, but this is normal results. You can see here that total bacterial load is rather low, is below 10 to 4th power, no DNA of sexually transmitted pathogens. We can find only Corynebacteria species, which is absolutely normal. Okay. Then let's look at the next result. This is not normal result because we have found Haemophilus species as the predominant type of microbiota here, and example, and it's consistent to total bacterial load. So here it is. Another example with predominance of Enterobacteriaceae enterococcus group, and it's also not normal for urethral sample. And this is the example of Neisseria gonorrhoeae detected by Androflor test. So really something with it. And the last topic I would like to speak about today is semen microbiota and its impact on semen parameters and infertility. We know that the effectiveness of ART programs is rather low around the world, and it doesn't exceed 38% per embryo transfer. And one of the key factors to get a success of the ART technologies is to get the embryos of good and excellent quality. In order to get these embryos, we have to have good semen samples, and still we do not know the cause of male infertility in many cases, and we are not sure about the association with male infertility, low semen parameters, with microbial community in semen. At the same time, there are a lot of changes in semen counts during the last 50 years. They are absolutely unexplained, but as soon as we know that urogenital infection could affect semen parameters, then we decided to conduct also our study. So we can use Androflor test for analyzing semen microbiota, and these are the normal results for this test. But when we analyze semen samples of men who are seeking artificial reproductive technologies, we found out that 72% of them contained bacterial DNA in their semen samples. And for example, in case of azoospermia, 100% of male patients contained bacterial DNA in the semen. So it's really not good. Also, we have found lactobacillus species in this patient, and many of them had impact on their spermiogram. Usually, the presence of lactobacillus could be associated with different hormonal disorders in patients. So we decided to analyze semen samples of patients who conducted IVF, and there were 111 samples. And what was also interesting, those were the patients with normal semen parameters, so they were perfect for IVF. But also, in 68% of the samples, we have found bacterial DNA, and up to 14 bacterial groups were detected simultaneously. Then we analyzed the results of the embryological stage of the IVF and calculated the percentage of good quality and excellent quality embryos obtained on the day 5 after injection. And according to Vienna consensus, the percentages, the rate of good and excellent quality embryos must be above 40%. So then we have found out that different type of microbiota in semen sample bring us to different results of the embryological stage of IVF. And in many cases, when we have found different microbial community, the percentage of good and excellent quality embryos was rather low, and we have no pregnancies. Here you can see two results. This is for a semen sample of a man patient where blastocyst development rate was 50%. We have obtained 2 embryos of good quality out of 4, and pregnancy was obtained. And the other variant, when the blastocyst development rate was only 25 and no pregnancy was there. And then we used again discriminative analysis and developed prognostic index, which allow us to predict the effectiveness of the embryological stage of IVF, just analyzing the microbiota of semen sample. You can see that a lot of parameters of Androflor test were useful for these purposes, and this test allow us to predict the effectiveness of IVF before the couple started the protocol. So, again, I have lost so much time with this clicker. And at the end of my report, I would like to point out that microbiota of female and male patients is different. And even we compared semen samples and cervical samples of our patients, and they were comparable only in 50% of the couples. And the main differences you can see at the slide. When we speak about the female microbiota, especially when we use the Femoflor test, we speak about the predominance of lactobacilli, while for male patients, it's a marker of pathology. Obligate anaerobes are not normal both for male and female patients. Aerobes are typical for aerobic vaginitis and aerobic dysbiosis in women, but it could be absolutely normal for male patients. And mixed microbiota, normal for male patients, while it's of course a marker of dysbiotic conditions for female patients. So now when we have these two tests, you have the reproductive health of your couples in your hands, and you can perform a comprehensive analysis of their microbiota and predict the success of IVF, of the pregnancy, and so on. So thank you.
Okay, thank you, Professor E.Voroshilina, for the very comprehensive and informative presentation. So I think I have a little bit more time for Q&A section. If let's say you have any questions regarding to the infertility and reproductive health to Professor, you can raise up your hand. It is a very interesting talk. I have my first time listening to about reproductive health. But can you give sort of like a general explanation on how does the microbiome affect the population? Because you've shown the population difference, but what is the general idea of why does it affect?
What happens? Well, you know, it's really a tricky question, because if we shall speak about vaginal dysbiosis, we know that the inflammation associated with vaginal dysbiosis is a negative prognostic factor for the pregnancy. And what is really interesting, that even if we try to cure the dysbiosis at the early stages of the pregnancy, sometimes we still have the preterm birth. And the best way is to prepare a woman for the pregnancy, for example, for the artificial reproductive technologies, so that she will start, for example, the IVF protocol with normal microbiota. Because a lot of changes happen in local immunity, and a lot of pro-inflammatory cytokines we can find in the vaginal, in the vagina, and they have a negative effect on the pregnancy, of course. So I think so. As for male patients, I think the same thing, because the presence of bacteria are connected with reduced semen parameters. And if we shall speak about the IVF, the procedure of the embryological stage, it's favorable for anaerobic bacteria, because the condition, the growth condition during this stage, they are fine, because they are anaerobic. And I think that's why we have found mostly anaerobic bacteria in those patients who failed to get enough good and excellent quality embryos and to get pregnancy in future. So it's you see, and those were patients with perfect semen samples, and these semen samples could be put into semen banks as well. But nobody looks for microbiota there. We just exclude the presence of some obligate pathogens like chlamydia, Neisseria gonorrhea. That's all.
Then, thank you so much.
Thank you.